Good afternoon, everyone. Good evening, depending on where you are in the world. My name is Tino Kuretu. I'm the founder of Pora Health. Joining us today is Wadzi Mayiseni, is a 21-year-old born cancer survivor and founder of Youth Against Cancer, a youth-run non-profit organization driven to advocate for better cancer relief efforts for all in Zimbabwe. Youth Against Cancer collaborates with like-minded individuals and organizations and runs numerous cancer awareness campaigns and fundraisers to achieve this mission. Some of the organization's successful efforts include coordinating a fundraiser which raised $800 to support children living with cancer and funding cervical cancer screenings for 50 underprivileged rural women. Presently, Youth Against Cancer is building a survivors network for patients and survivors to connect and inspire each other through storytelling. So now I will let Wadzi present.
Thank you so much, Tino. I'm so excited to be here. Thank you guys for inviting me and for everybody who's attending this meeting. So first of all, I would like to introduce my team member, Prayers Chisika, who's joining me here today, and she will speak at some point about Youth Against Cancer. Well, before we get to the presentation, I'll just give a little bit of background. So like Tino has rightfully said, my name is Wadzi Mayiseni. I go by Wadzi. I am a bone cancer survivor. And honestly, to get into the story of where Youth Against Cancer started, I'll have to start with my cancer journey because that's sort of like the inspiration behind starting the organization. So I was 11 years old when I was diagnosed with bone cancer. And so that was in 2012. Basically, it was during a physical education exercise. I was running and I fell. So the impact my left leg made with the rock that I fell onto was so great that even though I was an athlete and injuries were not new to me, I knew something was different about this particular injury. But I just, I was 11, so nothing really clicked. But I knew that this was intense. So my mom had to be called. I was in primary school, so my mom had to be called. I had to be taken home. But like I've said, injuries are not new, and we just treated them like all the other ones. My mom had heat wrap and bandages, so she would wrap my left leg where the swelling was, and we just hoped things would get better. But I think 2-3 weeks passed by and the swelling was increasing, the pain was increasing. So we said, okay, what do we do? We went to Red Cross. So I'm from Harare, Zimbabwe, and we just went to town, which is the CBD where I stay. And there was a Red Cross in town that we visited. They requested for x-rays. We got them. We went back. They looked at them and the doctor said, well, there definitely was a fracture in the leg. But from the x-rays is healing. So you can go back, keep doing what you were doing. We're going to prescribe some painkillers for her to manage the pain. But other than that, you shouldn't be worried. So we went home. 2 weeks passed by, 3 weeks. The pain was increasing. The swelling was increasing. They said, okay, maybe let's go to a proper hospital. So we went to Harare Hospital. And they also requested new x-rays. We got them done. So initially at Harare Hospital, I was seen by a junior doctor who, looking at the x-rays, said, I'm suspecting this is cancer. But I'm a junior doctor, so you're going to have to see someone senior, in the hierarchy. So I'm going to refer you to a senior doctor, and they can give you maybe a more proper or more substantial diagnosis. So I remember walking from Harare Hospital that day with my mom. I was 11 years old. I did not know what cancer was. The only limited or no information actually that I gathered was, when you're in primary school, I don't know if you guys used to do this, but at my primary school, there was this whole thing where if someone would write stuff on their skin using a pen, you'd just say, oh, you're going to have cancer, oh, chaita cancer, in Shona and stuff like that. But that was just something that we threw around as kids. We didn't really know or understand what it meant. So you can imagine my confusion as I was walking from hospital with my mom. My mom was quiet the whole time, understanding what was at hand. She was quiet the whole time. I'm pretty sure she was in shock. And I'm trying to process this whole thing that this word we've been throwing around as kids. Chaita cancer, you're gonna have cancer. What exactly is it and how grave is it? So, just to bring in an aspect of my story that's a little bit personal, but I think especially given this platform, working with Pora Health, that's primarily a public health / global health platform, I think it's also important to talk about how, when we were told that I had cancer, or when the junior doctor said he was suspecting I had cancer, we kind of ran away. So we were supposed to then come back for the senior consultation, but that didn't happen, or at least in the time that it was supposed to. So we went home. We said, okay, this is something that's definitely not medical. It's definitely spiritual. So we ran away from the doctors. We said we're not going to seek further medical attention. We sought traditional help. We sought spiritual help. We went to churches, traditional healers. And I bring this in because I'm pretty sure, as you guys, you practice, public health policies and stuff like that. You can understand that when you're trying to help someone, especially in this situation where, there's limited knowledge about what cancer is, and there's also conflicting traditional beliefs with medicine. There was no one really to meet us at the point that we were. And in hindsight, I always tell people, especially parents and patients I meet at this particular stage that I was at, that, medicine is a tool. And that's something that I've come to appreciate, that nobody's putting down anyone's traditional beliefs or practices. We are all just trying to work together to contribute to a better, to a healthier population. So that's something that I didn't understand. That's something that my family didn't understand. So I will skip, I think about 5 months passed by of us, jumping from one traditional healer, one church to the other, just trying to seek help. And then we got to a point where we said, okay, maybe let's go back to the doctors and actually hear them out. Let's seek the second opinion that we were advised to seek. So that's when we went to Paririnya Twa. I had there was a proper sit down explanation of what was going on. And then I had to be admitted. I had my left leg amputated and basically started my chemotherapy, then had 3 cycles of chemotherapy. And I like to think that's where the journey, or rather where the idea of Youth Against Cancer started. Because I was in hospital with other kids and their parents. And one thing that I really noticed was how, in as much as, we have different organizations in Zimbabwe, we're working at providing assistance for accessing cancer treatment, which is really expensive. We're looking at from 20,000, going up. And most of the families at Paririnya Twa for oncology ward, where I was, low income. You're looking at people coming from outside of Harare who sometimes have to be sent bus fare for them to come for treatment, something as critical as that. So imagine when we are talking 20,000 per cycle or per, container of treatment, whatever the word is. But just to contextualize some of the things that as Youth Against Cancer we then practice and we then value, there was all that. There were organizations like Kids Can who took me on board. They said, okay, we're going to help pay for your treatment and your hospital bill. And they did. But to be fairly honest, there wasn't really anyone outside of my family who really sat us down to ask us, how are you really feeling? What's really going on? How are you processing all this? And as I'm sure you guys are well aware of, mental health care in Zimbabwe is something that's just starting to be talked about. That's just starting to show face. So this was like 9 years ago and nobody was talking about mental health. So after being discharged from hospital, being clear of cancer, I went home. I had to reintegrate back into society, same primary school that I had left 3 months ago, and face people and face friends, kids who also didn't understand, okay, this girl left with both legs, now she's coming back with one. What's going on? At break time, having people stay at you. These are things that nobody really thought about to sit me down and talk about. So now we will touch on it, but it's part of our, when we then formed Youth Against Cancer, we were taking all these things into consideration, that there are different stages where psychological support is really needed and it's not being provided. So I worked with Kids Can from 2013 up to 2018. I was their brand ambassador, and basically I would speak at their different events, talk about my cancer journey, in a bit to just inspire people in the audience to understand what, from a survivor's perspective, what it means to be undergoing cancer at a young age and why it's really important to contribute towards cancer relief efforts. Then in 2017, that's when I said, okay, I'm leaving Kids Can soon because I'm going to be over age. But I really want to continue doing the work that I've been doing, but this time interacting with patients more. Most of the patients were my friends. I had, been with them in hospital. But I don't know if I should say the good thing. One thing about the Pararingato F Oncology Ward is you go in, if you survive, you go out, but it will continue being very close to your heart. And that's what happened to me. I had been discharged, then it was 5 years ago. But I would still visit every Christmas with the little pocket money I had. I would buy snacks, visit the kids, talk to them. And before 2017, I was just doing this with my mom. And then in 2017, I said, let me bring a couple of my friends. Maybe they're actually interested. And to my surprise, there was actually about 10 of them who were interested in going with me to the hospital. So that's really where the idea of Youth Against Cancer was born. Back then, it didn't really have structure. We were just doing things that we knew were important. We were providing psychological support to these kids, would go in the hospital with our snacks, but would also talk to the parents, would also talk to the kids, play games with them. I think one thing that was really clear at that point is we wanted to let them know that there were people thinking about them as they were going through this really, really tough journey. We were thinking about them and we were wishing them well. Youth Against Cancer was just an idea. We didn't even know it was going to be called Youth Against Cancer. But that was really where we started, and that was the goal. That is where we started with the whole thing. So I'm going to give it over to Prayers, who's going to talk to you about when we then started, forming structure, realizing we actually could be an organization, some of the things that we've done. And yeah, so over to you, Prayers.
Thank you, Wadzi. So I'm just going to share my screen. Okay, so I am going to firstly talk about just a continuation from what Wadzi was talking about, a Christmas party we hosted. So in 2017, we had a Christmas party at the oncology ward. So as you can see on the screen, these are just some of the pictures of us when we were there and when we were also in the wards. So we gathered a few friends and bought a few items like snacks and little treat goodie bags for the kids to give them. So we would go in to the wards and talk to the kids and their parents. And at that point, that's when we formed this special bond. Wadzi already had a special bond with Pari, but after this first Christmas party visit, we figured it would be really nice to do it again the following year. And then the following year in 2018, we were going to host another Christmas party like we had done the previous year. But then we heard that there was a diaper shortage. So we decided to host a diaper drive, and we were able to raise a lot of diapers, as you can see in the pictures. And we also got some boxes of Cerevita too for the kids. And we hosted a party. It was now in January when we had our Christmas party, but it was delayed due to the diaper situation. So we went with a couple of friends and other people who we knew too, and we were able to deliver the diapers and also just see the children and just spend time with them and their families. And they were very happy. And at this point, we discovered that we actually could form something solid. And that's when we started to really develop the idea of Youth Against Cancer. And we just started to just keep an eye out for anything that we could help with. So after the diaper drive, we had the remission celebration. So as you can see, remission is the reduction or disappearance of the signs and symptoms of a disease. So because of the previous encounters we had had with the children, if they went into remission, we would celebrate with them and their families. So here are some pictures of some of the remission celebrations we had. Then we hosted a Fund a Biopsy campaign. We heard that there were women with cervical cancer and that needed to go for screening but could not afford to go for this process. So we hosted a cupcake sale at different churches, and we would bake the cupcakes as the Youth Against members at someone's house and then sell them out at different churches. So I think from there we raised about $300. That was for the transportation of these women because they were from remote areas. And then we also reached out to Pick and Pay, and they were able to also help us and donated 5,000 bond. But at that time, it was equivalent to 500 US dollars, which was really great because for each woman to have to go through this process, we had an aim of 50 women. We wanted to help 50 women, but after raising about $500, we were able to actually help about 70 women in total, which was really great. Then after that, we had a Capital FM interview and awareness where some members of Youth Against Cancer went out and talked about cancer, about us as Youth Against Cancer, and then just spread awareness of cancer in Zimbabwe. And as Wadzi is going to go into details about our goals, we really want to reach out to the younger generation to be really aware about cancer and so that we are able to fight this together. And after this, we had a Mask for Change last year in 2020. This is just when COVID had started, and we were basically joining Kunda Care. We had a combined fundraising with Kunda Cares, and we helped to support a number of people by selling masks through the Mask for Change sale. And we were able to spread awareness from this and also raise money for the screening of breast cancer because this happened during Breast Cancer Awareness Month, and we were able to raise about $80 from the mask sale and I think about 90 bond from the sale that we were able to help raise for the screening of breast cancer. Then in 2021, in 2021, we had a Valentine's social. So this was not really a fundraising event. This was more of an awareness spreading event. So we were able to find some of the young influencers in Zimbabwe, and we were able to host them for our social. So that helped us to attract many people, and we were able to just have a good time celebrating Valentine's and also just spreading cancer awareness and just informing everyone about Youth Against Cancer. So we're just trying to reach out to as many people as we can. And So we did not include this on our slides because it was a very recent event. Just in June, we hosted a June and Jazz, and it was also another social event that was also to raise awareness and just spread awareness of cancer in Zimbabwe. But this one, we it was more of a musical, so we had some of our best performers in Zimbabwe perform on our social, and that was able to attract a big crowd and also inform people and just alert them about cancer. So now I will hand it over to Wadzi to just speak more on our goals.
Thank you, Praise. Actually, please may you reshare your screen, but go back to our mission statement and values. So I think that's something that we also have to touch on. Yeah, thank you, Praise. That was beautiful. So I think hopefully as you guys, as Praise was taking you guys through some of the things that we've done, one thing that stands out is our passion for including young people in the fight, and it starts with awareness. So basically, with every event that we have, we're thinking, how can we appeal to young people? What would be interesting for young people to listen, first of all, before we even say anything, for them to listen, for us to gain their attention? What can we do to do that? And then when we've garnered their attention, when we've gotten them to listen, then we start talking, we start having these conversations. And the importance of having young people in this discussion is, cancer is currently one of the leading causes of death worldwide. So it's really affecting us. And I think from a public health point of view, as we have less and less of the infectious diseases burden, we are leaning more towards the non-infectious, the non-communicable diseases. And cancer is actually one of the leading causes of death. So really the burden falls on us as young people, as we're growing older. Are we educated enough? Do we know what's going on? How can we prevent cancer if we can? What do we do? Are we equipped with the resources to support ourselves, to support our families, and anyone we come across with who may fall into this predicament? So I'll let Prayers share. I'm not so sure what happened because she had her PowerPoint up just now. But also the other thing that we really value is collaboration. So as you can see from the screen, our 3 pillars are cancer awareness, advocacy, and collaboration. Cancer awareness is pretty straightforward. We want people to know what cancer is. It's really complicated because with things like, for example, HIV, everybody knows that it's a sexually transmitted disease. Do not share sharp objects. These are things we were being taught even in primary school, and we knew. But who's talking about cancer? Most people, if you say cancer, they immediately think breast cancer, maybe prostate cancer, and that's it. But there's so many other cancers. There are some that are actually preventable. We're talking cervical cancer. But do people know this? Do people have this information? So as Youth Against Cancer, we're saying, let's talk about it. Let's raise awareness so people are equipped with the knowledge and the resources to do the right thing. And then there's also advocacy. We're saying, like we've mentioned, there's so many kids. I'll just go back to the diaper drive that we had in 2018. This is something that wasn't talked about. Kids living with cancer have other needs outside of treatment. We're talking diapers. We're talking some kids, when they're receiving treatment, become sensitive to some foods. So some kids can't have sadza. It's too thick, so they have to have something that's light. But can the parents afford that? And are people aware of such situations, such circumstances for them to help? So when you talk about advocacy, best example would be that diaper drive where we identify a need was communicated, and we took it to the public to say, these kids are already going through so much. You have a 2-year-old who's going through the pain of cancer treatment, and now they have to have a diaper unchanged the whole day. That's unnecessary. Let's join hands and do something. So that's what we mean when we talk about advocacy, the needs of these cancer patients that they and their parents may not necessarily have the platform to talk about and be heard. But we are saying, let's amplify their voices and let's join hands. Let's facilitate help towards them. Collaboration. I'm pretty sure you've heard different names being mentioned, from TM Pick and Pay to Kunda Care. We've worked with so many different people. Even with our Valentine's social, we had different influencers come on board and work with us. Because at the end of the day, we realize that this is a battle that's bigger than us if we're fighting by ourselves. I've mentioned Kids Can Before. There's Elizabeth Chanakira Trust. I'm pretty sure we'll get to a slide where we talk about our support network. But one thing that as Youth Against Cancer we've realized is we're not going to be competing, quote unquote, with already established cancer organizations. No, that's not necessary. The need is bigger than whatever else may exist. So what we really want to get at is, okay, there's someone who's covering cancer treatment. What else is not being covered? Even with psychological support, what else is not covered? Maybe there's an organization that's dealing with psychological support for adults, who's dealing with psychological support for young people, for infants, whatever the case is. It's basically a collaborative effort. Where are the areas that there are problems, but they are not being fully addressed? That's where we're coming in as Youth Against Cancer. Sorry. Prayers, please, may you go to the next slide. So some of the values that I've already touched on: community service, everything that we do, we're trying to put the patients and their families at the very core of our approach. How can we meet them where we are? Leadership development. As I've mentioned, this idea about Youth Against Cancer started when I was really young, before we even knew it was going to be called Youth Against Cancer. But I tell you, over the years, through working with people, through leading these different initiatives, we've managed to grow as a team, individually also. Love. I mean, everything that we're doing, we're considering, is this coming from a place of love? Are we being empathetic towards the situation that the kids and their families are going through? Mentorship. We're going to talk about Survivors Network. I am here today. Cancer, my cancer journey is only one aspect, one fraction of my being. And that's because I was able to have people come on board throughout my life, mentor me, not only with regards to my health and how to keep fit and everything, but also things outside of that. Kids are discharged from hospital. There's a whole life waiting for them beyond cancer. How are they going to integrate back into society and actually make it? We're talking about kids who've lost limbs like I did. We're talking about kids who've gone through this really horrendous journey. It's something that they will need support, getting back into society and actually dream big beyond this seeming limitations that their circumstance may pose. Okay, Prayers, please go to the next slide.
So I don't know what's going on. I'm just going to stop sharing my screen for a second.
That's okay. I think the next slide is talking about our mission, just in writing. I mean, it's really echoing what we've already been talking about, how we have on-call care, delivery, and access and delivery at the core of our approach. We spoke about underrepresented communities in Zimbabwe. So the first point is actively contribute to better on-call care delivery and access in Zimbabwe, regardless of one's socioeconomic status or location. I'll give reference to the Fund a Biopsy campaign. When Priya spoke about us raising, the cupcakes, doing the cupcake sale, selling cupcakes at churches, so TM Pick and Pay agreed to cover the expense of the actual screening. So we partnered with Baines, and Baines Pathology gave us a discount at which they would process the VX samples. Another collaborative effort. But really, we realized some of these women who want to get screened don't have the money to come to get screened in Harare. And at that point, we didn't have the capacity to run maybe like a nationwide cervical cancer screening thing where we would go to every community and get them screened. So we said, okay, we'll bring them to Harare. But what we're going to do is fundraise to cater for that fee. So we sold cupcakes, and from the proceeds of our cupcake sale, Each Youth Against Cancer member was paired with a patient. Again, maybe you may be asking, how did we get these patients? We worked with Parirenyatwa, had to go through records. Some of the patients had come earlier on in the year, but they couldn't come back for maybe like checkups or the actual screening. So we're calling those patients. Mama, what happened? We see that you came in January. Why didn't you come back for your screening? Why didn't you come back for your results? We got all that information, and then we paired up each Youth Against Cancer member with the patient, facilitated their bus fare, and even when they came for the actual screening, we took turns to go to the hospital, talk to them, have an understanding, even outside of, the whole cancer thing. How are they living? What are their living conditions wherever they're coming from? So one thing that we really value, I've mentioned the psychological support, but also having a holistic approach to healthcare delivery and access. We want to understand some of the reasons why people are not seeking care. We want to understand some of the reasons why people are running away from care. And that was really what we were trying to do when we ran the Fund a Biopsy campaign. Provide psychological support to cancer patients and their families and friends from diagnosis to remission. There's a slide we showed where we had about 2 or 3 remission parties. And to be fairly honest, in as much as we are with the patients when they're going through the tough times, we also want them to know that this is a big thing. Conquering cancer is not a small thing. And part of our reintegration, helping them reintegrate back into society, is during these remission parties, we'll just go around sharing experiences. I would share my cancer story, especially after being discharged from hospital. Youth Against Cancer members would talk about, their different experiences, whether with someone who in their family who had cancer and what they saw as they're integrating back into society, and even share advice when it comes to like going to high school, going to university, all that stuff. And then there's raised cancer awareness primarily in young people of Zimbabwe. I've already touched on this. And yeah, so now I will move on to the goals that we have. You've heard a lot about the stuff we've done, and I'm pretty sure at this point you may be asking, okay, so what's the next step for Youth Against Cancer? And the simple answer to that is there's still a lot. We have a lot on the table. Like I've said, cancer is really big, and in as much as we've done all these different events, to be honest, sometimes it really feels like it's not a lot because the need is just great. There's so much that still needs to be done. One thing I'll start off with is the radiotherapy machine. So at Parirenyatwa, there was one radiotherapy. Actually, let me circle back. So in 2020, as of 2020, there were 2 radiotherapy machines at Parirenyatwa, and towards the end, the only remaining one, so one broke down early on, and then towards the end of the year, the other one also broke down. So we're looking at patients who had to get radiotherapy as part of their treatment, having to be referred to South Africa or other countries. And just to remind you, some of the populations that actually everybody needs the care, but we're looking at some populations that can't even afford bus fare, and they're being told, go to South Africa for treatment. In 2012, had to get a bone scan just to make sure that everything was clear. There was no longer any cancer cells in my leg, even after amputation. But there was no bone scan machine in Zimbabwe, the whole country. I had to be referred to South Africa. These are some of the inadequacies of our healthcare that are costing people. So what if I actually had, remaining cancer cells? It was going to come back, and maybe I wouldn't be here today. So I thank God I've been in remission for 9 years. These are things that are important. So one of our goals is Youth Against Cancer. So we've divided them into small goals, big goals, and the radiotherapy machine, something that we're looking into. Even if they end up having one, how can we amplify that effort? End up having maybe 5 even radiotherapy machines spread all over Zimbabwe. I remember when I was getting treatment, actually, we had the Harare Oncology Ward was the only place in Zimbabwe that was offering cancer treatment. So people would come from Bulawayo, all over Zim. They would all come to Harare for treatment because that was the only place it was being offered. That's terrible. I'm pretty sure you can imagine. And even in between your cycles, your cancer treatment cycles, you're very vulnerable because your immune system has been kicked by chemotherapy or whatever cancer treatment you're having. And now you have to use a bus with 50 people to go back home. Imagine the risk that these kids are being exposed to. So these are some of the things that go unnoticed because we have people, we're dealing with treatment, and we think, oh, that's okay. So long we have kids, our problem is solved. No, it's not. There's so many gaps that need to be addressed. The other goal that we have as Youth Against Cancer is starting up a survivors network. We started talking to different patients. This is something that's been ongoing, but we actually want to give it some structure. We've mentioned collaboration, and I'm happy to see Ruvimbo Mirakotanaro because she's the founder of Tose Foundation. They run a educational access program, nonprofit organization. And when we're talking about Survivors Network, I'm thinking when we have these cancer patients recover, they are gonna want to go to high school. They're going to have to go to university. We want to encourage them to dream big. So when it comes to collaboration, these are some of the things we're considering. I'm already thinking I'm going to be having some of my cancer patients, some of my cancer survivors come to Ruwimbo, work with her, and stuff like that. So when we talk about collaboration, it's across the board. It's not only in terms of health. We're also thinking in terms of mentorship. How can we encourage these young people who've undergone this horrendous journey but have made it to come back to society, contribute, give back, but also for themselves to actually do well, And well, the other goals that we have, thankfully, when we had our June and Jazz program, we had people volunteer, but we're still to register as a 501c3 nonprofit organization. We're looking forward to registering in the United States just for logistical reasons, but at some point we're going to transition to registering in Zimbabwe since that's where our target population is. And the other thing is the website, which we're currently working with someone who volunteered to help us with. So that's in the works. And awareness in schools and underprivileged communities. Our current, I'd say burden, but not really. We've been able to do some things even with all of us all around the world. But really, some of these things you realize you really need a lot of people on ground. And with Youth Against Cancer, that's not really the case. Most of us are in university. We have about 5 of us in Zimbabwe, but we're still working towards at least developing some program where we can actually go in schools, go in these underprivileged communities and talk about cancer awareness. I mentioned at the beginning about how my family and I ran away from medical attention because we had these beliefs. And you realize that, especially with cancer, it's something that's held, that's usually perceived in a spiritual regard, if that makes sense. It's taken to be something that's spiritual. So most people tend to run away from medical attention. And basically with awareness in schools and underprivileged communities, what we're just targeting is saying, we understand it's okay to have your beliefs. Everybody has those. But we also want to equip you with the knowledge that medicine is a tool. And when ready and willing, please, by all means, use it. Strategic partnerships, it really speaks to the collaborative efforts that I've spoken about, working with different people to see how together, it's so amazing how, especially as young people in Zimbabwe, our generation, our age, we're really, really good at identifying problems and coming together to give solutions. So basically with strategic partnerships, we're looking at, I've already mentioned Tose with Ruwimbo in attendance today. There's so many other people we've worked with, we're looking forward to work with, even us being present here at Pora Health. It's a collaborative effort because you guys have identified that, by amplifying our voices, Youth Against Cancer, something may come out of that. So that's really strategic partnerships. We're also looking at partnering with people who may have access to spaces that we may not have access to. One thing that comes off, as I say this, is governance. I'm pretty sure you guys as public health, global health people, you understand the need to work with people in power, the thought leaders in these communities. How can we influence them how can we equip them with the knowledge and understanding and resources that are cancer related so they can pass it down to everybody else, and also make way for us that when we then want to do some of our initiatives, we don't face as much resistance as we would without the partnerships. I know it's been a long talk, but I hope you guys stayed with me. That's Youth Against Cancer. In terms of how you guys can support, well, you know, we've spoken about collaboration. If you know someone, any organization that would be interesting, you know, please follow us on our social media pages so that when we advertise some of the things we're doing and you know someone or you yourself are able to help in any capacity, please reach out to us. We are more than willing to work with different people. But the other thing is also on our social media platforms, we spotlight different organizations who are doing really amazing work that's cancer related. So it hasn't been official yet, but very soon there'll be Kids Can Run that will be virtual for people who are not in Zimbabwe, but in person for people in Zimbabwe. We're going to be talking about that on our page. So for now, what I will say is that follow us on social media. There's different ways, different ways we put up that you can support not only Youth Against Cancer, but different organizations trying to alleviate the cancer plight in Zimbabwe. We also share resources where if you need some cancer screening or you know someone undergoing cancer who needs support, we share different resources on our Instagram, Facebook page. So please follow us and also reach out to us if there's anything that that you need to know about. So that's it from us. I think it's time for questions. So I don't know if Tino, there's a way that you want us to do this, but it's pretty much open floor from now on.
Yeah. Wadzi and Prayers, thank you so much for the wonderful presentation. I took down a lot of notes. People in the chat box were sending in a lot of questions. So, I mean, just in summary, again, one of our audiences did mention that this was a very clear presentation. They really appreciated your goals and your mission. But I think I was very much fascinated by how holistic you understand the problem, how you holistically understand the problem and how you're really approaching this issue. Just to sort of like highlight what I got from this presentation, first you sort of like highlighted through your story and also through a few other anecdotes how our healthcare system in many ways is inadequate. Just to give you an example, you mentioned how in the country we have very few or limited like radiotherapy machines. You talked about the struggles of cancer patients sort of like reintegrating into society. There's a lot of like misunderstanding on how to go, how people would like understand the disease in general and how they can best help cancer patients. You touched on poverty, which is one area that we as Pora Health, we're kind of interested in. You did mention how some people literally can't afford, bus fare or something like that. Then they expected to pay 20K for like radiotherapy. You talked about mental health, a very relevant topic and an emerging issue in the country. You discussed the pandemic. You talked about education, that is by way of talking about Torse Foundation, and also using your own personal experience, how your school was sort of like unprepared to have you and sort of like get set up again into the system, and also generally talking about how in many ways there's a lot of, there's a lack of focus on the healthcare system side or even on the government side of things. So I think it was very holistic. We really appreciate the work that you guys are doing. Without further ado, I feel like I will get into asking the questions that people are asking. So I'll start by a question from one of our associates, Olive. So her question is, in line with cancer awareness, I would like to believe people barely pay attention to health conditions unless they fall victims or people close to them do. How do you manage as Youth Against Cancer to bring cancer conversations to people who don't know cancer from a personal experience? For example, encouraging them to get screened for breast cancer or any other type of cancer.
Prayers, do you want to take this one?
Sure. So I would say one of the key things that Wazi talked about is how we like to connect. So I think I could use some of our socials as an example that we find fun way to engage an audience, but also making sure that we're putting our awareness on the table, that they're able to understand that they need to get screened. And we also have on our social media, we on our story, we also have the cancer awareness every month. So there's different cancers every month that we put on our Facebook and Instagram pages, where we just educate people on how to get screened, like for example for maybe breast cancer, how to screen yourself, and also just the different types of cancers that we have as a society. So that way we're able to incorporate everyone and to help them to understand how they can go about it without having to ask us questions directly. So they can just view our story, and maybe that can inspire someone to just try and test themselves or screen themselves to see how if they're okay. And then from that initiative we also share different links as to where they can go to inquire for the treatment or screening or any help they can require. And also our DMs are always open for people who want to ask questions. They can always ask us and send us a message, even a private message, or we always have the tags on our story too, where you can ask a question anonymously too, where you can just ask a question and we can just answer it on our story.
Yeah, I also just drive in the point home that, you know, with some of these things, June and Jazz, Valentine's Social, it may seem for someone from the outside. I remember for June and Jazz, when actually advertising, there was a concern that it seemed as if it was a concert and nothing cancer related, and the argument was, well, that's a good thing because people are gonna come thinking, well, you know, well, thinking that it's a concert, and then whilst at it, we talk about cancer. So it's not really to trick people to talk about cancer, but you may think about it in that way, that we are first of all considering, we know the awareness that we want to spread, but we're also considering the population that we're dealing with. What appeals to young people? You know, I've mentioned this before when I was presenting, that the question we're having is, what can we do to get them to listen first before we even say anything? What can we do to get them to listen, to get them to attend the events? And then whilst they're there, we then have these conversations. So just plainly echoing what Prayer said, we're really looking at our target population. We're looking, I would give an example that, you know, if it means we're going to be at Enzo's house, you know, making a song with Enzo just to get people to hear something about cancer, we're willing to do that. So it's something that it's a great question actually. It's something that we do think about, that, you know, first of all, cancer is something that's mystified. You know, you just, yeah, oh, ningakaita cancer, or someone died of cancer. So people don't have these conversations. You know, do people even know people survive? Do people know that it's actually something that's beatable? You know, so it's something that's very secluded, and we try by all means to bring it into conversation by different ways of engagement. So yeah, but thank you for that question, Olive.
Yeah, thank you for that great answer. Our second question is, what do you think is the wisest and most appropriate thing now we as Pora Health, or say the general members of the public, could do for cancer patients, regardless of gender or age?
I will start on that. I'll get us started on that. And then Prayers, if you have anything to add, you can always jump in. I think the most important thing is to show up. Plainly stated, is to show up. We have our own planned events as Youth Against Cancer. We spotlight other organizations doing fundraisers. We do our own fundraisers. Other organizations do fundraisers. Sometimes it doesn't even mean, you know, donate money. Sometimes it's just being a part of the cause. Sometimes it's, we say we're going to a hospital. You may not have anything, but you show up, you know. So I think one thing that's really the driver of our mission is realizing how young people are so removed from cancer efforts. When we talk about Kids Can, it's for kids, but you will see at these events, Kids Can events, and there's maybe like Madran, I think that's usually when young people come. But some of the events, you only see older people. And the question is, where are the young people? So we are doing our best to share resources of what's going on. How can you support? And really, the best way is to show up. If you can donate to the different causes that are running cancer relief efforts. If you can't, there are so many other ways you can show up for cancer patients. The other thing is, as we're sharing this awareness, the awareness information, take it in. Share it with other people in your network. We usually post once a month when it comes to awareness campaigns. Repost our video, screenshot a picture and post it on your WhatsApp story. You never know who you're going to reach out to. And I think that that's some of the ways that I can think about from the top of my head. I'm not so sure, Prayers, if you have anything to add.
Can you just repeat the question for me?
Sure thing. So the question is, what do you think is the wisest and most appropriate thing now for members of the general public to do for cancer patients, regardless of gender or age?
Okay, just adding on to what Wadzi was saying, I think it's also very important that to understand, like, let's say you have a family member or a friend or anyone that you know that has cancer. I think it's really important, like what Wadzi was saying, you don't have to always help financially. You can just be there for them. And if you have a friend who has a family member who has cancer, I think it's very important for you to just be there for them, just to spend time with them, just to talk to them about how they're feeling. Like, this just taps into the mental health aspect of things, where just to understand and just try to be there for them in any way you can. It's always a hard conversation, just trying to get someone to open up, or to get someone to really talk about what they're feeling. But they would definitely appreciate that extra effort that you're taking to just to be there for them, to just understand. And I think if you have someone that you know that has cancer, it's important to just maybe just do a little research onto the type of cancer that they have, and just be aware, and just be knowledgeable, and just try to be there for them as much as you can, by understanding what they're going through, understanding what they need, and also understanding that you actually can help, even though if it's not financial. Because usually I think the stereotype that people have is, if they hear cancer related, they're thinking money, and they're thinking, I don't have enough money. They're thinking big figures, like, how am I supposed to raise 15K? I don't have that amount. But it's the simple things where they could have the finances that they need, but then they don't have someone to talk to about their journey. They don't have someone to express what they're going through. So just being that emotional support, if I may say, is very important, regardless of the gender.
Yeah. Once again, great answers. So the main takeaway: show up. It doesn't necessarily have to be about money. Contribute however you can, and watch with whatever you have. Then another question we have is, I would love to hear more. What sort of engagements you guys do to promote psychological health?
Well, first of all, I want to say I really love that question, because it's something that we're continually asking ourselves, how can we do more? And to start off with, I want to touch on the challenges that, this is something that we're really into. We want to provide psychological support, but none of us are social workers, none of us are therapists. So in as much as we would want to do more, there's a limit to that. So with the Survivors Network, one thing that's also going to be part of that is incorporating, or rather partnering and collaborating with experts in the mental health space, people who can actually provide that psychological support, who are trained to do that. Because to be fairly honest, in as much as we are having, for example, these remission parties, there are times when it weighs down on us. I'll share a very personal story to Youth Against Cancer. We lost someone, we had actually celebrated a remission party, and then the cancer hit back, I think a year after, and she died. So, and you could tell that everybody was devastated. We actually need to also be talking to someone. So in terms of psychological support, we are having, these remission parties. We are talking to parents. I have like 2-3 parents that I've been talking to since 2018, and the list keeps growing. So with the survivors network, we're also looking to grow that. How many more patients can we take and actually support, but also by ourselves before we incorporate the therapists? What efforts can we do, can we put in place to let them know that they're not on their own? I personally, within my own capacity, I try as much as possible to share my story. I was actually laughing with Prayers because she's had my cancer story so many times, and I was just saying to her, you need to close your ears tomorrow as I'll be sharing it. But one thing I understand is the audience is always going to be different. There might be someone in the audience who will get some comfort from just hearing. Maybe they have interacted with cancer in some. All right. So maybe they've interacted with cancer in some capacity. And just hearing someone, I've had so many people, after sharing my story, just say to me, thank you, because you just saying your truth really encouraged me in my journey. So that's part of the things we're doing, but it's a question that we're also trying to challenge ourselves. How can we do more? And like I've said, it's also really tapping into the space of experts and being guided. Actually, in July, we're planning for a conference where we have different oncologists, social workers talk to us about different ways to show up psychologically for cancer patients. So aside from the cancer visits and WhatsApp chats and calls and everything, we are also trying to educate ourselves on how best we can meet these patients where they are and do right by them, if that makes sense. I don't know if Prayers, you have anything to add.
No, I think you summed it up.
Yeah. Thank you so much, Wadzi. I'm pretty sure. Like we can't keep on asking you more questions. You probably have somewhere to run to. But thank you so much for this great presentation, the amazing answers you guys gave. I'm personally, I'm very inspired by the work you guys are doing. And you did mention that one of the things that you're interested in, or one of your pillars, I believe, has something to do with collaboration. We would be interested in seeing how we can work with you. So I'm pretty sure my team and I will look into that and see what we can do in order to help with what you guys are doing. But as for everyone, thank you so much for joining us. We understand that you have busy schedules, so thank you for blocking this time out of your schedule to join us today. And if you're interested in what Youth Against Cancer is doing, you can follow them on Instagram, follow them on Facebook, and we'll also post stuff on our page that is related to their work, so that if you're interested in connecting with them, you can always do that. So their Instagram handle is at Youth Against Cancer, ZW. But yeah, thank you, everyone. I hope you enjoy the rest of your day. Thank you.